You guys are live.
Okay, thanks. Good afternoon, everybody. This is the Thursday, July 30th, 2020, 2 p.m. Board of Health joint meeting with the Select Board. Just like to remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you do not have an audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. And for roll call purposes, for attendance, I'll go through the Board of Health first, just say whether you're here for the record. Melissa Murphy.
Present.
Jim Cooper.
Here.
Malcolm McNabb.
Here.
I think Meredith Lepre is not going to be here. Steve Disco is present. And with that, I'll turn it over to Dawn to open up her section.
Thank you, Steve. I will call the Select Board meeting to order. And I'll just go through a roll call. In the order in which I see you: Melissa Murphy.
Present.
Jason Bridges.
Present.
Matt Fay.
Here.
Christy Ferrantella.
Here.
Okay, that's everybody.
Okay, thanks. We also have John Giorgio from Town Council. We also have Greg Corbo from Town Council. Amy Baxter's. And we also have Libby, Town Manager, with us. So we'll start with the, do we have any public comment before? I don't know if Roberto, do you see it?
No, nobody has their hands raised or anything.
Okay, so we'll start then with the, turn it over to you, and we'll start with the COVID update.
Yeah, just one of the things that we're doing right now. I don't have one of my PowerPoints ready. It's been a little hard to get that done this week. So my apologies for that. I don't have a lot of the metrics done, but if we were to do that metrics, you would see all across the board, it would be all green, which is really good. Our positive test rate has dropped. It's down to below 1% again. Unfortunately, with the sampler for the Surfside treatment plan last week, it was down. So we only had the one from Wisconsin, which came back as non-detect. We're waiting to get back the report from this week. I haven't seen it yet. It might be in my email. As far as cases go, we're up to 41 today. We're around 1 case per day. But once again, that we're pointing out there, we're trying to get out to as many people, is we have a lot of people on island. So 40 or 41 cases as of now is, we're still doing very well. We're still doing very well. There's a lot of chatter that you see out in social media and a lot of emails that I get, and I'm sure you all get the same emails of people saying, you know, we're seeing a spike and we should shut everything down or things like that. It's not worth of a panic. Yes, when we entered June, we only had 14 cases and now we have 40. But that was expected with the large amount of people coming in, large influx of summer visitors, and proportionally, we're still doing better than the Cape, and we're still doing better than the rest of the state as a whole. So that is something really important to just keep our perspective. We put those metrics in for a reason so that we don't accidentally do any knee-jerk reaction responses. And with that being said, though, we do get a lot. We have been discussing with a lot of the restaurants and retail and things like that. And a lot of them are voluntarily closing early. And what we are seeing already is, in general, and I'll turn it over to Amy for the enforcement review so we can get into this deeper, but just anecdotally what we're seeing out there, and I was out Saturday night, and I was out there Friday as well. Amy was out there the whole weekend until 1 o'clock in the morning every day. So thank you, Amy, for that. She's been a trooper. What we're seeing is that it's after people leave that final sitting in the restaurant that is starting. That's where we see the risky behaviors. You may have seen the Boston Herald article from yesterday where we just kind of coined the term risky behavior, where it's after people get inebriated, after there is a little bit of a rougher situation, you're not seeing a lot of mass compliance. People are congregating in groups and you're seeing these sorts of things. So we have some good things to show. People are really seeing it, and a lot of restaurants are voluntarily looking into closing earlier. So unless there's any questions, I will go ahead and just turn it over to Amy. Yeah. All right.
Sorry, I thought I saw a hand. Malcolm, did Malcolm want to say something?
I just had a question on the metrics.
Mm-hmm.
With the governor's new order, goes to the metrics of our capability of doing testing. And a lot of friends and people have said, well, I'll get tested when I get to Nantucket. Do we anticipate, or does hospital anticipate, come August 1st order, there'll be an increase of testing and it may start pushing our abilities?
So with the people who want to get tested on Nantucket, they should be making those appointments now. They should be going to the town of Nantucket website and clicking on COVID-19, going to the left where it says COVID testing, and then clicking again on the right side where it says sign up for asymptomatic testing. Because if they have an appointment for the day they show up or something like that, then you don't have to worry about the hospital turning you away or anything like that. Because if you're asymptomatic and you're not on their appointment list, they will turn you away. If you're showing symptoms, that's a different story, and you go through the symptomatic line at the drive-through. So we do not foresee an overflow of people where the hospital won't be able to handle it. However, that is because they're making appointments for asymptomatic
It's always the however that I'm concerned about.
The however is that it's appointment based for asymptomatic, so they should be making the appointment as soon as possible.
Yeah.
I have a friend in the real estate business, and they're advising their people coming from the riskier states to get tested at home and bring that documentation with them, because they realize that these visitors will not, they're not going to quarantine for 14 days. They're not going to, if they're here for a week, if the hospital says we can do it Wednesday and you'll hear back on Thursday, they aren't going to quarantine. So what they're sending out letters and they're advising their clients is to get it at home before you leave and travel with it, which I think makes a lot of sense.
Absolutely.
Melissa? Go ahead.
Thanks, Stephen. I didn't hear you. Thank you. Yeah, Matt, in my business, we are doing that also, but I'm coming up against people coming from communities where they also can't get rapid test results and meet that 72-hour benchmark. And I recognize this is a challenge for, and I think this is why I wanted to have some conversation around this new order from the governor because I think it's unclear to folks how, in fact, this is going to be enforced. And I had a couple of questions. One, and I don't know if Roberto, you know the answer to this, when they do fill out that the travel form, who receives that form and that information and what's done with it? My assumption is it goes to the State Department of Public Health, but I've been getting that question, so I just want to confirm that. And, you know, if they get tested, but they can't get the test results, are they expected to quarantine for the few days that they're here until they can get their results? And then what will our actions as a community be for enforcement or oversight of this? Will we be doing inspections of logs of lodging associations or rental agencies? Are we expected to keep certain information on file? So there's a lot of questions, I think, that came with this new order.
So that's a lot. That's a lot to answer. As far as I know, when they fill out in all of our conference calls that we've been getting, as long as sorry, I got a phone call. When they fill out the travel order, it goes to the state DPH. If they're putting us as their final destination, theoretically, we're supposed to be getting them, but until it doesn't come into effect until August 1st. So I haven't seen that in practice yet. Hopefully they do send me the list of everyone who's been registered saying Nantucket as their final destination. We have been hearing anecdotally, and I've been having some conversations with some of our lodging members here. They have said that they've already sent out information to all of their people who are registered and have reservations for those times of the year, that if they're going to do that, the travel form, to make copies of all the travel forms information and also get them a copy. So that's actually really proactive on a lot of our lodging groups, and we really applaud them for that, so that they have it, in hand, so that in case they were to get, you know, for lack of a better word, audited, they would have all that information in hand as well. As far as enforcement goes, one of the things we are looking into is you may have seen in the Inky today, there was an advertisement for a temporary part-time inspector for night shifts. And what we're looking to do with that is that person can, you know, I'll pay attention to where the house parties are, things like that, but also drive around and take a look at where the quarantine lists are. People who are supposed to be quarantined, they can maybe do, drive-bys, making sure that they're complying with quarantine. I think those were three of them. Did I miss anything, Melissa? Okay, and I think that's a good one. And I think Libby also has something to add to that.
Just want to add, we've been looking at this quite a bit, and possibly one or the other of town council could address this, but I've been trying to find out what other towns are doing. No one is actively enforcing this, and the expectation is that the Department of Public Health enforcer, and if they need assistance from the local Department of local health departments, they will so request it. Towns are not expected to enforce it. Does that mean we shouldn't enforce it? No, not necessarily. We do obviously have our hands full with all of the other enforcement, but perhaps if we're able to hire this temporary inspector that Roberto spoke of, that is advertised in the paper today, maybe they could do something like go to the lodging groups and just, take a look at their ledgers or whatever for the people who are staying there. It's not necessarily public information either, the mass travel form. So that's just another thing that makes it a little bit complicated. But presumably that information goes to the contact tracing agency or agencies to help with it on that level also.
May I say something? I just wanted to mention in the real estate business, this has all gone out to all of the tenants who are coming from high-risk states. And it's actually being very well received. The comments that I've heard back, people want to be completely in compliance, want that negative test, and are really kind of glad that they have that option now, rather than the advisory for a 14-day quarantine. So I think we'll see a lot of voluntary compliance. And I just wanted to mention that.
I agree.
Melissa?
Thanks. I do agree. Also, Donna, we're experiencing the same thing at our office. I do think it might be nice, and I didn't receive this because I'm not a restaurateur, but I think at some point Amy, or maybe Amy and Roberto, sent something out to restaurants about rules and regulations as they were changing or coming down the pike. And it might be nice to have something official from your office, Roberto, that just outlines what your hopes and expectations are for anyone in lodging and real estate, or to NARAB, so they can get it out, and the Lodging Association, so they can get it out, just so that there's clear communication in the community about what expectations are. Thank you.
We can get something out. Absolutely.
Yeah. Go ahead, Matt.
It's Matt. Before we leave this topic, it's not the hotels, the way they write it, they've written it, the state has written it, hotels, Airbnb, presumably short-term rentals, are required to report out of state. And the way it's written is, if people want to complain, they have their own phone number, and then they have a link to all the Board of Healths. So, so people that want to complain that, geez, these people came from Texas and they are not doing what they're supposed to do, what the state is saying is go contact the local Board of Health. So, so people may be saying we don't want to do it, but I think the expectation the state has set is that, there will be some type of enforcement. That's at least how it reads on their website. So I think we have to sort of be ready for that and have an answer to that.
Go ahead, Lynn.
This is a conversation that's going around all the towns, and I certainly wouldn't characterize it as nobody wants to enforce it, but the governor's order specifically says in it that the Department of Public Health is the enforcing authority, and if they need assistance from the local departments of health, they will request it. So it is pretty specific in the state's order. That doesn't mean we can't go and do some checking as needed.
Chrissy?
Yeah, just a follow-up on that. What I read with the state order was that the Department of Public Health would be doing the phone calls and monitoring to make sure that people are quarantining. So I assume that would be state agents that were doing a lot of the heavy lifting, and then possibly reaching out to local boards if they find somebody not in compliance.
Greg?
Thank you, through you, Mr. Chair. So I just wanted to reiterate Libby's comments and the comment that was just made, that the order on its face is quite clear that enforcement is delegated to the Department of Public Health with the assistance of the local boards if necessary. The guidance does contain a link to the websites for local boards of health for purposes of reporting non-compliance. However, my recommendation would be, if the town were to receive a report of non-compliance for this particular order, that the first order of business should probably be to contact DPH and inform DPH of the complaint so that DPH can take the action that is necessary.
Anybody else want to add anything? Okay, so do we just want to move on to the next part of the agenda, the review of that inspection report?
So Amy, you're up.
Okay, thank you for having me today. I don't know, Roberto, did you have a separate inspection report, or are we going over the enforcement plan? I just want to make sure I'm doing the right thing.
No, I think it's just yours. Yeah.
Okay.
I'll throw in as I can.
Great. Okay, so I think Erica's going to share quick. We just have a high level plan here that I just wanted to outline kind of what we're doing. I'll reiterate everything that Roberto said are the same things I saw this weekend and the past weekends too as well. So just kind of want to go over our thinking and how we're centralizing this. And again, it's just an expansion of what we do on a normal basis, but this is going to be focused on COVID-19 related emergency orders and policy and our main goal and policy in this of enforcement should be to educate and promote compliance. That is our goal. Hopefully working with all these businesses and folks to get towards compliance. The priority again is with these COVID-19 related directives and emergency orders. Again, we'll see other things, I'm sure out there, violations of existing regulations and bylaws must be reported to the managing department for enforcement, calling of dispatch or the police only if public safety or disturbance and immediate attention is required. So when we see things that are going to be a violation of liquor laws or fire codes, those things need to go through their general process that we already have established. And we're just highlighting here where we keep all of our updates. We try to go through all the state orders and make it an easy spot, our back to business toolkit for these businesses to understand. So there's no need to say, well, I didn't know. We certainly are keeping everything here as much as we can. Okay, the next page, Erica. Thank you. As far as enforcement, again, some of this information I did acquire from the Mass Police Chiefs Association that put out kind of a guideline for tackling these types of things that went out throughout the state. So we put up kind of an escalation grid. It's kind of going through the warning system and how we are approaching these. Upon issuance of each escalation measure, we're looking to allow at least 24 hours for folks to comply unless, again, it needs immediate attention or public safety is at risk. And we will be communicating in writing, and I'll show you soon kind of our grid there, to the Select Board and Board of Health for all these actions that are being taken. So you're kind of updated as to the reality of things. And it's expected that police presence and such will be limited and will be required only when there's immediate threat to public safety. So again, the recommendation, I think this is how we've been working, is when a violation is seen that there's verbal consultation and redirection, hopefully at that point, if distance isn't being kept, masks aren't being worn, that we work with that business or in that immediate moment to get to compliance. Again, if we continue to see that written redirection, which we've done for many cases, generally anytime I see anything, we follow up with written notice. Just said, hey, we saw this. This is the action. Please make sure that this is communicated and taken care of. Again, if it's something consistent, which I myself have not gotten to this point, the fining system, which is up to $300 per the orders, up to a maximum of 3 times before escalation to the next level, which is a cease and desist letter. And there's different formats for that. So that has been our policy moving forward. Can we flip to next slide? Okay, thank you. The team is various. Again, this is a team that deals with these things on a normal basis. Led by the health department. We have fire department inspectors that I've been out with many times doing this. Myself, licensing inspector, building inspectors as well, because occupancy and accessibility is another issue here too as well. Observation and reporting from town administration. Obviously, those folks who know the orders, if they observe, they will communicate to us to take action on the particular business if needed. Again, police observation and through patrol reporting only. They obviously see things and come across things and have been very much communicating with us throughout this. And again, we have the COVID ambassadors that are dealing with mask order and information only throughout the day. So that's really the main team of people who are out there with this. As far as schedule, We're doing this daily. Obviously, as part of our jobs, we're out there daily as our schedule allows throughout the island. The additional dinner late night service has been going on, Thursday through Sunday, obviously, is the busiest times, but throughout the week, that is going to be the additional service that we're looking to help with. And then we follow up to community complaints as reported, which we've been getting, and I'm reporting those too as well. And I generally communicate with the business immediately upon receiving those. We flip to the next. Good. So we have a checklist. This is kind of what we're looking for. Again, what I'm trying to emphasize here is the inspection checklist for this, the COVID-19 related things that are the main priority right now. And these are the things that everyone going out can use to really kind of temper what their observations are and help us in the reporting so it's consistent. Again, the setup, number of tables, indoors, outdoors, number of seats, bar areas obviously are important if they've been repurposed for table setups. Is anyone sitting at a bar? To be able to observe that area and that type of setup. Distancing, again, as we all know, the distancing between tables. Sometimes I see things, they don't look right, but Roberto's actually been out there with his tape measure and make sure. So that's kind of how we've been doing that. I'm like, I don't know. And he helps kind of follow up with that. 6 guests maximum, large gatherings. I saw a couple of those this weekend and the establishments took care of them. Are there a mixing of guests? Are people roaming the other tables? I saw that maybe once. Masks, again, as usual, are all the guest masks when they're waiting or going to the restroom? Are all staff wearing masks, front of house, back of house type of things? And again, some public safety things to look out for as far as all these setups, proper barriers. And that's a public safety, just kind of noticing the setup and if things are creeping into unsafe areas. In addition, obviously, there are things to notice that may come under some other codes and violations that will be taken care of, but we appreciate observations in this. As far as liquor, there are associated COVID-19 regulations right now, especially with to-go orders. People are taking the fact that they can get drinks to go to mean they can drink in the street no matter where they are. So that's something important to watch out for. Entertainment, we put out those entertainment guidelines. Again, these are things to notice, making sure spacing and all of that is taken care of. And occupancy is another big thing that we are taking a look at. These outdoor spaces cannot increase anyone's occupancy. That COI number is that COI number, no matter where these folks are located at this moment. So that is our basic checklist as far as helping everyone report the same amount of information. And we can flip to the next. And this is just a quick kind of a snapshot of one of my charts. And I don't mean to call anyone out here because there are some violations here as well, but it's just documenting and stuff as far as we go, as far as dates, location, the type of complaint, what the source was, whether I saw it, someone saw it, or it came in through a resident or other type of place, the actual bylaw or whatever that was violated, and the action, and link to kind of my written actions or any fines or anything of that sort. So, and we can pull this all down now. I can go to questions. I didn't want to, again, call any of these folks out. Thank you. So that's the basic, and we're going to try to centralize a lot of these reports through our office here as well, so that we can kind of really go to one source. We're not dealing with rumors or this or that we're keeping that all together and our communications together and keeping that consistent throughout the team. So we'll take any questions if anyone has anything. No, all good? Oh, Christy.
Thank you. And thank you, Amy, for putting this together. I know Matt has been asking for a written enforcement plan for a while. My question is with the types of complaints. So the policy is to start with a verbal. So say Friday night, you got a complaint that there was seating at a bar at a restaurant. You have a verbal reprimand for that. And the next day, tables are not 6 feet apart. Would that count as a verbal for a different violation, or would that go to the next step of a written violation?
I think, and we might have different opinions on that, but I think at this point, They have been fully informed on this. I think it's a second violation. You know, we do that with liquor and other things too as well. They're very informed and have that information unless there was some sort of outstanding circumstance. But again, the verbal part is if I'm actually seeing it on site, which I saw something on Saturday night and I immediately told the doorman and he took care of it. I also followed up with a written to the manager saying, hey, this is what happened. So, and then all of a sudden the tables are pushed together. That's another COVID. It's a COVID related violation. So that would be number 2 for sure. And I think we've been very clear that warnings are warnings, and then it's going to just keep escalating from there. But for the most part, everyone has been for the most part working immediately upon that.
Thank you.
Thanks, Jason.
Thank you, Christy, for asking that question and getting clarification. Thank you, Amy. I think I agree with Amy's approach and how you're going to go and implement that, because we all know, like we talked about this last Wednesday night, everybody knows. I think if it's a verbal and a written, and even if it's in the same night, that's pretty good, right? Before you're getting, that's to me going on the easy side at this point in the summer. So I'm glad that we're not separating them up. COVID is a COVID violation, and 2 can happen in a night, right?
Right.
Thank you.
Matt, who actually was on our inspection team Saturday night, who was out as well.
Well, I've been out a couple nights, and I will say, when Amy is out there, when there's a presence, people are following the rules. I've been out other nights when there's nobody around, they are not following the rules, and it's evident. I'm not going to name the place, but I drove by one, and there was a bunch of people piled up, and I went around the block, and I came back, and Amy had pulled her car up, and they were dispersing. They were all running, and the staff is telling them to, hey, get out of here, get out of here. So the businesses know what they're doing. The customers know it's wrong. The businesses know that it is wrong, and they are, and so I think having a presence there is important. I think this is a huge first step. If you're looking for comments, I think a plan has to be measurable. I'd like to know, how many written notices to date, where are they filed, all that stuff, it has to be measurable to be effective. And so, this is a really great first step. We need to make sure the system's right. Is it possible to look at these? How many written notices have we done? Where are they being filed? What people are going when? Are we covering every night? Are we covering until 1? There's details that I would like to see fleshed out, which I think we easily could do in the future version. But I can't impress upon people the importance of, the businesses are asking for help. It's the restaurants who are complying are asking for help. The retail businesses are asking for help. I had a bunch of other people in just different industries saying, wait a minute, we were closed for 2 months. Did we close for 2 months so that privileged kids can party every night until 1? That's not what we signed up for. So there's a lot of upset, people worried that there's some dangerous things happening, and asking how come we are not, and asking when and how are we going to, help them. And so I think this is a really good start. So I want to commend Amy. I saw her. She did a really nice job with everybody. I know that she's out there and and I'd love to see us, more proactive.
Christy?
Yeah, just a follow-up to Matt's. I think it's a really great point to measure the data that we're collecting. So that might be able to provide some more insight of when the violations are happening. It's all been anecdotal that it's at night, but there might be things going on with lunchtime or, if retail's different times of the day. So I just think that that's an important thing to be able to track maybe daily or weekly and see where the different non-compliance is.
Yeah, I'll respond to that, and that is what we're trying to centralize that here too as well. And I saw as far as Saturday night, obviously the restaurants working hard. 11:30 to 12, it gets messy, and honestly, the messiest parts were non-alcohol related establishments and lines. I'll say Lower Broad Street was just after midnight. I stayed till close to 2 a.m. and that's just not. It's just massive crowds, no mask. Most people do this and will get the mask up, but that was the messiest part, honestly, of most nights. Roberto, I
just want to say is also to Christy's point, I'm out doing lunch inspections almost every single day during the week, mainly because we're located downtown. My office is located downtown. And sometimes I'll take an early, and I'll leave at around 11 so that I can walk around downtown for about an hour, or I'll leave at noon or at 1. Yesterday was at 2 o'clock, just random hours. And I do spot checks in retail and food establishments. So we do have a presence. John was just out there today doing his rounds around town. So during the day, during the week is a lot easier to do spot checks during the day. And then we also have the COVID officers out there those days too. It's a lot more compliance during the day, and that's really good. And we're still seeing it there. And again, what we were saying early on in the metrics talk that what's that word? I don't know why I'm blanking out on. Herd immunity is based on 75% of people. And I would say being out there, more than 75% are people wearing masks. You do see people without masks when they're drinking, when they're eating. We are seeing, on occasion, you'll see a person who doesn't necessarily have any drink left in their drink, but they still have it up to their mouth because they don't want to wear the mask. We do see some of that, but it's rare. It's rare. And people saying I'm just not going to wear a mask because it's my constitutional right, or any of that other bogus stuff that gets popped up. We're seeing that very rarely now. I think it's mostly at night that we're seeing the problems.
Melissa.
Thanks. I just wanted to add to Matt and Christy's point. It may be helpful, and I don't know how you want to or will report this back out either to the Board of Health or the Select Board, but not just the list of violations, but I think if I'm hearing you correctly, Matt, it's like 10 people went out on inspections this week. Here are the times. Here were the general observations. We had to give a written warning. We had to give a violation. So there's some sense and transparency, I think, not just to us, but for the community about how often this is happening. Because it's hard to speak to that and to assure the community that enforcement is in fact happening when we just hear, yes, it's happening, but having some sense of how often in some kind of report, I think then gives us the measurable results.
Greg.
Thank you, through you, Mr. Chair. The other issue I wanted to bring up with regards to the importance of record keeping with respect to the licensed establishments is that, when the season is over and things start to calm down, it might be appropriate for the select board to take a look at which license holders had significant numbers of violations or citations, because under the rules of the Alcoholic Beverages Control Commission, a violation of the COVID orders could be grounds for disciplinary action against the liquor license. And so, that's something that the license holders should be aware of, and that the select board can keep in its pocket for now, unless there is some egregious case. And then, once things die down, can revisit this either through having disciplinary hearings or at the time of renewal, so that, this is, I think, an added enforcement tool that the town has that might make the job of the inspectors a bit easier.
Thank you. That's helpful for us, Matt.
You have, have you kept written documentation from beginning till now of how many verbal warnings and all that?
Yeah, and I did some today. I usually follow up if something happens and let the manager know if I didn't speak to them directly. Yes.
Right. Yeah, because that's important, and that should be tallied and like we're saying. And I think if restaurants and which are really de facto bars now, if they know this is being tallied and it's important, I think there's a chance of compliance. So I think it's important the documents and know what's going on. It's great.
Yep.
I would, as far as the select board, the Board of Health goes, and Roberto can correct me if I'm wrong, anything that he does or our inspectors do any time of the day it's all logged in.
My inspectors, everything they do, they put into their our performance management system, and it goes out into the magic area of the cloud, and Google crunches all those numbers for us, and it comes back in a nice, beautiful Excel sheet that tells us exactly where they were, who was there for how long, when, and where, and why.
Jason.
Thank you, Mr. Chair. Is there was talk of us having either Board of Health, Select Board, or both enforcement report each week? And so we would, even if it's put in the packet the day before as an addendum, because I know it takes a while to put it all together over the weekend, at least for a Wednesday Select Board meeting. Will we get that weekly or bi-weekly? Maybe someone's already said it and I missed it.
Yeah, we're trying to keep, this spreadsheet and all this information. I'll work with health and others as far as how they're reporting. So I have staff member here who will help gather that. So at least to have that chart, we can go through and see kind of what's new and what happened. Yes.
I think it'd be okay, even if it went in as an addendum on Wednesday morning or Tuesday. I know it takes a while to gather it all. I think it'd be helpful if it's possible.
Yep. Agreed.
Does anybody have any other questions for Amy? Okay, we'll move on to the next part on the agenda. Review of case status.
So there's a lot of conversation out there. One of the reasons this is up there is because, what I said earlier about how June 14th in June we had only 14 cases, now we have 40. There's always a lot of conversations about, well, how many of those are active cases? So the good news on that is we only have about 7 active cases right now. So that's really great. That's really great information. And we are tracking all of them. We are running into the occasional problem with contact tracing where we contact the case and we ask them questions, or Elizabeth has been amazing contacting them and saying, where have you been? What have you done? And sometimes with some of the newer cases, we are getting the occasional, I don't want to answer these questions, I'm too busy right now, and they hang up. And we are getting some of that. Those are the ones that we stay on them. Elizabeth has been great. She calls them over and over and over until they finally answer these questions. So that's really one of the reasons why it was on here, just to get a lot of the information out there. We do get a lot of conversations and a lot of accusations that we're not being transparent enough with some of the cases, and that is personal choice. I don't want to give out a lot of information to people where people can be identifiable. And yes, there is a lot of information out there. And the Nantucket rumor mill, we all know, we've been a part of it. So it's it's a lot of information out there, but the good news is just because somebody was a positive case doesn't mean they are a positive case now. And that's what's really important to understand, that right now we're only really tracking about 7 to 10 positive active cases. And most of them are about to finish their quarantine anyway. So that's really good. And that's really all I have to say about that. If there's anyone else who wants to throw in. Jason?
Thank you, Roberto. When do you take them off that list? Once you get a negative test back, or after 14 days, or both, or?
Sometimes both. Usually it's the negative case, but also the case. Sometimes the case gets taken off the list because they went home, and we transfer it to a different jurisdiction. So we had some cases where they got the nasal swab on Saturday, and then they went back home to their home state on Sunday, and then we got the positive test. So the moment it came back positive, we counted as a positive for us because they were here as when they were contagious, but they're no longer an active case for us. We immediately do the contact tracing, we do for the time that they were here and for their infectious period, and then we transfer the case to their local Board of Health. So a lot of times that's why we don't have such a heavy active caseload. And yes, once they start getting their negative tests for some of the asymptomatic carriers, it's one negative. They quarantine and they have their one negative test after the 10 to 14-day quarantine. If they're asymptomatic, then that counts. That's no longer active. If they were symptomatic, then they get fully monitored until they're showing no symptoms anymore, and then the negative test. Matt, I know you had something to say.
Yeah, mine was, you sort of answered a bit of it. I know that we have exported some cases, and so I was wondering how they're handled. Possibly people came and came with it, or some of their friends came with it. They went home. How do we? Are you in contact with other Board of Health? So did you have to trace back with them and handle that? And so our numbers, if we're, do we take them away if? For example, we find out, a bunch of people left and got home and all got tested. What would we do with that?
So all the numbers that we have received, regardless of whether they live in another state or not, we still count them. We are still posting it. And we're doing that because of if they got it here, we're taking responsibility for that. There were two examples that I'm going to be giving. So one of our cases from this last week, and I say in the last 7 days, when I say this last week, one of our cases came back. We got it because I got a phone call from a public health nurse in this person's hometown saying they tested, they got their positive test. And when I spoke to them, they said they're working on Nantucket for the summer. So we still counted that case as ours because they're here. They came here even though they tested back home. And then in our case, there's a lot of information out there about a certain house party that happened with kids who came here from Connecticut. There's a lot of that rumor out there. I did get in contact with they go by the county system out there. So with the county Board of Health, the county health department. And when I spoke to them, it was actually the way they were explaining it and the way we spoke. I'm trying to not be rude because I can't use the same wording they used. But it was basically what they said was they already had it when they were here. They were already sick when they left for Nantucket. We are sorry that you have to deal with our S''apostrophe kids. It's words. The way they were described was not flattering. So they're saying, they actually said to us, we're sorry that our cases ended up possibly contaminating you in Nantucket. They didn't see it as they came here and got sick on Nantucket and then went back home. So we do have that cross information based on the information that we're getting. When they do contact tracing, they say, I was on Nantucket for 3 days, and that's probably where I got it. So they give me a call to say they were at whatever restaurant and whatever place, they went just because it's the central location. They went to Stop and Shop, they went and ate, they got ice cream, and then they went and got a drink at whatever restaurant. But most of the time they were at home in a party. So then we start paying attention and do contact tracing on our end, only for the time that they had those contacts here. So we are in conversation, in a nutshell, we are in conversations with other boards of health and other states.
And that's good. And just so everyone knows, Nantucket was a topic of conversation at another select board meeting in the same regard that Roberto's talking about.
Yeah, it was interesting to have that conversation. What you're hearing at the select board meeting in that town, we all know the town, but I still don't want to say it. In that town in Connecticut was not flattering to Nantucket, but when I spoke to their health department, they were not flattering for themselves. So it was really interesting to see the two sides of the same coin.
Melissa?
Thank you so much. Roberto, thanks for all of that. So it sounds like as of today, our case status is manageable and, God, I hate to use this word, positive, in that we've got a low number of cases currently active on the island. But one of the things that I continue to struggle with, and maybe you can help me with this, is the number of cases overall can be somewhat deceiving when we hear 40, because we've had such a jump in numbers in the month of July, and 40 is overall since, I think, March. Is that right? So for me, and we got this late breaking recommendation. I'm happy to talk with you more about it, but from a community member about perhaps a metrics that measures tests and infection rate, so we can see a simple percentage by week. And I don't know if that's helpful, but I'm just relaying the message. And then two, so I think it's like number of cases per week given a sense of population base that we have, because I think that's a really important context for the community to see that even if we get 1, 2, 3 cases in a week, that's not necessarily cause for alarm, or and to be clear, what number in that percentage would be cause for alarm. Does that question make sense to you? I hope so.
No, absolutely. I was seeing that metric that just got emailed to us. It makes sense. I can look into a way to do visualizations on that. What we already have a metric, though, is for the percent of positive cases. I think it's metrics 1 or 2. I believe, it might be number 1, where it's just the percent of the positives that we get. And that is based on the amount of tests that we're seeing every week. So, and actually daily too, we can get the daily percentage, because you're seeing, for example, on the hospital website where it says out of 126 pending tests, we had 1. That's less than 1%. So we already have that set up. And about, 2 weeks ago or a week ago, I had a yellow put on the metric as we hit the 2.5% positive rate. And that was all from one restaurant, and it was all from the people living together. So we had a small localized outbreak within restaurant staff, and then we were able to kind of put the clamps on that, and we turned the metrics back to green because we were able to stop the spread there. So one of the metrics is already there. The other metrics I'll take a look at and see which way I can do those visualizations. I think a visualization is always pretty good, and it speaks volumes.
Thank you. I appreciate that.
Malcolm?
Yeah, I mean, that metric might actually be more useful than some we have. Or the first one, Because remember, as we increase our testing, the denominator goes up. So almost by nature, the rate will stay low. It would be very interesting to see the population or the percent of the population per week, which would actually be lower than that metric. But
Yeah.
the point is, in a population, a summer population, one per day is not much.
Yeah.
But all right.
Yeah, one per day is not much at all. And considering the population we have on island right now, if we're getting even 3 or 4 in a day, we're still doing surprisingly good.
Yeah, I mean, we can do metrics forever and modeling forever and everything forever, but I think the metric suggested is an interesting one.
Yeah.
Jason?
Thank you, Mr. Chair. I agree. I think when I try to explain it to friends or community members, 1 per day is okay because we have the contact tracing that we do, because Roberto and Elizabeth are all over it, and they can contain what you referred to, Roberto, is like that small outbreak of 2 or 3 people who live together. Because we're on top of it and working with the hospital and the extra testing and all the different things, take that away, then I'm not so sure one would be comfortable. But with all this stuff that we're doing on a daily basis and that we worked on for 2 or 3 months, I agree with that. And that's why I try to explain it and talk to people about all the stuff that we know that's going on, because we have these meetings, we read all these reports, and I think it's good to say why one is still alarming and serious, but it's okay because of all, all the things that I just kind of went over, and probably some more that I didn't mention. Thanks.
And I think we can keep it that way as everybody follows the protocols. Like Dr. Fauci has said, wash your hands, socially distance. It works. And, what I've seen downtown when I was there yesterday, I was, now I'm mask conscious. I'm always looking around, and, it was good. Everybody that I saw was wearing their mask. I didn't see any groups together. So I think you're getting the message here. Does anybody have any other questions for Roberta? So we'll move on to the next item on the agenda, the review of restaurant and food service hours.
So that's the question at hand. Amy, correct me if I'm wrong in any of this, but what we're really seeing is a lot of restaurants are already saying we are voluntarily closing early. A lot of restaurants are already saying we're doing last call at whatever hours. They're not all consistent, but some are saying 10:30, some are saying 11, some are saying 11:30. And it really has shown up that the restaurants that, people were calling the problem restaurants, they're actually the ones who are voluntarily saying, I want to close at 11. And it's been really impressive.
Yeah, I'll echo that statement too. I probably have a dozen correspondents here with different locations that say, look, everyone is trying as hard as they can, but it just gets so messy at a certain time. Obviously, by midnight, it's beyond, and it becomes, that much of a problem. In one restaurant that we had that, had been seen as a problem, the staff got together and said, we don't feel comfortable with this anymore. And they have actively shut down earlier. I think the comments have been, look, we'd like to get a third seating in, which is later, 9:30, 10 p.m. But by probably my thoughts were, last call at 11:30 and done by midnight seems to be at least very reasonable, because it gets to the point where the young crowd, and not to disparage, the youngsters there, but tend to be just a little bit more loose with the masks, with the gathering and things of that sort. And then the restaurants are taking it on as far as that they're doing something wrong and they're just having trouble with that. So I think that's been the consensus, is that it's just, at that point, it's just drinking, and, bar scene is not safe, obviously, right now.
So are we thinking this is, some type of curfew order that we want to institute instead of just making it voluntary?
So that's one of the things that we're looking into, and I want to ask the boards to look at. We as the Board of Health have the authority, and John, I did exactly the same thing Jason just did. I called you George Giorgio. John Giorgio is on here, and I think Greg is on here too. Correct me if I'm wrong on anything. I think the Board of Health has the authority to create a early closure limit for food establishments, not the liquor licenses, food establishments. Then we can say that food service establishments have to close at X time during the day. What we're seeing is, in general, after around 10:45, 11 o'clock, you're seeing more of what we were quoted as saying risky behaviors. The risky behavior is not wearing the mask, congregating, things like that, and even sharing drinks is some of the things we're seeing, especially when it's that last call and it's just, wait, give me just a second, I got to finish this here, that sort of stuff. So I would recommend, personally, I would like to see closure around 11:30, but I know that there's also recommendations of last call at 11:30 and closure at midnight. I want to see what the board has to say. Amy, if you want to throw in here too on any of your recommendations too.
I'll go to Greg.
You're welcome, Amy.
Yeah.
So just a note about the legal standard here. If we're talking about issuing an island-wide order that all food service establishments close at a certain time, it's my opinion that is something that is within the general regulatory authority of the Board of Health under Chapter 111, Sections 31 and 122, for the board to issue orders to prevent nuisances and sources of sickness within the town. In order to justify such an order, you have to be able to demonstrate that the order is reasonably related to the protection of public health and safety. And given the numerous examples that Roberto has just given and that Amy had given earlier, in my opinion, it seems clear that there is a link between the hours that these establishments are open and what Roberto has called the risky behavior, which is creating a threat to public safety. Now, Steve had mentioned a moment ago a curfew, and I just want to make sure that it's clear that there is a distinction between requiring the restaurants to close at a certain time and a curfew, which means that everyone has to be off the streets, either within a certain area or in the island as a whole. And there is a more stringent standard for justifying a curfew, given the implication on individual rights there. So, if we were going to talk about a curfew, we might want to get a little bit more involved in the legal standard for that. But I just want to make sure we're using the right terminology here.
Melissa?
Thank you, Greg. I think I'm pretty much solely responsible for the confusion on the language. I think I accidentally used the word curfew last week like 2 or 3 times, and I meant early closure, so I apologize for that. And last week at the select board meeting, I said I was very much in support of this, and to you and to Amy, Roberto, as a board member, I feel like I can only make reasonable decisions based on your recommendations in terms of how it affects public safety. And I want to share a couple of comments on both sides of it. One, I hear a lot of support because just what you said, Amy, I think there's a lot of irresponsible behavior, not necessarily happening at the restaurants themselves, where one might assume enforcement would be a powerful agent to stop that. But it's what happens when people leave that. And so what I feel like we're really contending with as these two different boards is lack of personal responsibility and how do we safely enforce that? And to me, the only tools we have is to create the safest environments we can with reasonable amounts of enforcement. And so for me, while I hear for some restaurants, they feel like don't penalize restaurant owners by having early closures because there's maybe a few bad apples. What I'm hearing you say is that it's not bad apples in the restaurant industry, it's bad behavior by individual people, usually happening once they leave the restaurants. And that's going to happen whether they're leaving a restaurant or leaving a private party or having a beach party. And we just can't possibly control that level of personal responsibility, but we can work to create the safest public environments that we can. And if your recommendation to these boards is to have these early closures, not curfews, then in the interest of public safety, to create the healthiest, safest possible public environments that we can, I'm in support of that. In addition to this, great enforcement that you've been doing and the transparency of the plan that you have, that I think gives the public confidence that we also take enforcement very seriously and that we are working town-wide as a team to make sure that everyone's playing by the same set of rules. But I just keep going back to COVID-19 control is a huge amount of personal responsibility, and we can't possibly legislate that. And what we can do is do the best to create safe environments. So, that's how I'm feeling about it.
If I can just comment on the one thing, I want to talk about is I know originally I believe the state order is that folks obviously need to be seated, no bar seating, and that food service should be with the alcohol service. I think we've had some allowance for folks sitting down, just having drinks. So if we focus on the food service, once it gets midnight and it's just pure drinking, that's where obviously the issue is. So tying food service should be important because I think we've allowed for some of these other things. And that's where, they should, if they're open, they should have food service available. So that's part of the conversation I wanted to have on that too, as well, as far as not going directly for the liquor license, but just saying food service needs to be available and talking about that and being clear about as far as food service ending and then when folks would need to be off premises, because that's kind of how we deal with last call. So to be clear on that, if any decision is made.
Jim?
Roberto, are you talking about all food establishments, whether they have liquor license or not? Ice cream shops and like that would have to close at 11, everybody?
Yes.
That's what you're saying?
Yes, because in general, the idea would be that when people are leaving, they're not just congregating in the next location. By having this close across the board, food service close across the board, not food retail, which is important, which would be Stop and Shop, but food service closing at 11, it would prevent that roving group of people. You end up in the situation of people leaving the restaurant and they say, well, now what? So, and when you wait for your Uber, you get a taxi, you try to get home in some way, it actually takes a lot of effort, to be honest, especially whenever I remember my fraternity college days, actually going from a bar to a house party actually is a lot more effort. And we're going to get a good significant portion of people saying, I'm just going to go home and go to bed. Even if it does, it does push some to house parties and it does push some to other risky behaviors. It is still mitigating by some level. It is still mitigating the risky behavior of COVID transmission. So by closing all of them at around the same time, it makes it even across the board.
Malcolm?
Yeah, I'm struggling a bit with this because I think Melissa said it well. A lot of this is personal responsibility. And if we do this, I'm not sure we're doing it just so we all feel good that we're doing something. or will actually make any difference. Because actually, once you're in the restaurant, you're in kind of a restricted regulatory environment. Once you go out of the restaurant, there's no place to go. You're going to go home or to a party or somewhere. You won't have that restricted environment. So maybe we'll be making it worse. So I mean, I don't know. It all comes down to we get a lot of complaints. We're not doing enough. We're not enforcing enough. But it all is personal responsibility. And closing it at 10 or 11, I'm not convinced it'll make a big difference. But I have to think about that.
It's a good point. Can anybody tell me across, the Cape or the Vineyard, if any of the other communities have something like this in place?
I spoke with my colleague in Provincetown. She's the one that I bounce with the most ideas. And they've had this in place already. They've had this in place for a while. And I know there's a couple others, but and John, correct me if I'm wrong, Chatham has something like this in place too. But I definitely, Provincetown told me that they have it in place, but I just haven't had a chance to really go through the other boards of health and ask.
Roberto, these days I'm usually in bed by 9 o'clock, so I can't answer that question.
Fair enough.
I think Boston, from what I understood, Boston had on their new outdoor spaces 10 p.m. weeknights and 11 p.m. weekends, I believe, at least as they started.
John?
Is the 10 and 11 when food or when they shut down? I'm a little bit worried about 11 o'clock causing a problem with the final food thing and getting those reservations more spread out, especially going into, I think the next 3 weeks are going to be our busiest weeks of this whole summer. And I want people more spread out if they're going out to dinner if possible.
Yeah, I think from my responses from restaurants, they would like that third seating. So we're looking at 11:30 at least, and then everyone out by midnight. And the responses I'm getting from folks as far as the closing is that people make better decisions earlier. It's the later nights when there is no food service that their people are getting more aggressive, and it's harder for some staff to deal with. So that's what they're saying. Even though they're on their premises, it's not worth it, and it's causing a problem.
I think if I can just follow up on that, I think that something like 11:30 makes a lot of sense, and I feel like so many restaurants have already decided to do this that it's pushing the crowd into too few establishments, and that's causing a lot of problems as well. So I mean, I think that we would be wise as a community to institute this for the rest of the season, but I would be much more supportive of last call at 11:30 to make sure that they get that like 9:30, 9:45 seating and not try to shove people out the door.
I think what you'll see customers will adjust. If they know that it's 11, they're going to come out. They're going to go out a little earlier. I think they're going to do which is fine. But so I think I agree with Don. 11, 11:30, 11:30 is last call is fine. The one I think about which businesses will be if this is applying to all food service. Does that mean Cumbies? Does that mean the businesses on the strip? I want to make sure I'm clear what the recommendation covers.
Yeah, so we're looking at food service. So Cumbies and Stop and Shop are retail establishments that happen to have food service in them. So they are exempt from this because this is the food service only groups. And so a retail grocery store, people who have the grocery permit as well. We have a supermarket permit that exists as well. So those are the ones that are exempt. But it would be just food service.
Have you guys thought about what may happen if the food service portion of some of those businesses still remains open? Will the crowd all go there for frozen hamburgers, for example? And what will that impact be?
That's That's a difficult what if. A lot of the package stores are already closed by that point. So yes, you'll probably see some people show up to Stop and Shop or something and say, I want, to quote a good movie, let's go get some French toast, something like that. You'll see some of that, but I think that would be pretty limited. I think it would be pretty limited to find people going in to get a frozen hamburger from Stop and Shop at midnight. And that's the thing. If we do act, one of the things Don brought up, which was a great point, that if you close, if last call is at 11 and they're out at midnight, most of these Stop and Shops already closed at midnight. So they're not going to be able to go there. And their food service is already closed by that point for both Cumbies and Stop and Shop. So you're not going to be able to go grab a chicken sandwich or some French toast.
Something natural.
We are not a bad idea. We're closed long before that, I promise you.
Yeah. Christy?
Just a few of my thoughts on this. I've had a lot of conversations with restaurant managers and owners and kind of had the same feedback that Amy was saying, that most people are doing this on their own. So I'm a little bit concerned about kind of stepping in and mandating if everybody's kind of self-complying, if we need that extra layer. But I do agree with Dawn that if it's just leaving a few remaining, then it could be beneficial to have it island-wide. I think it should be an 11:30 last call and see how that goes. If, the next week or two we're seeing a ton of complaints and, this personal responsibility, and it's the people, not the businesses, that are, very difficult to manage, and the risky behavior that's happening around town, but, between 11:30 and 1 a.m., then maybe we look at an earlier closure time, but I'd start a little bit closer to midnight than cutting back to 10 p.m. I'd be in favor of doing the food service with the drinks if that's a requirement that's across the state. I'm a little concerned that we're different. We don't have bars open like the Chicken Box or the Muse because you can't have bars. So why would we allow restaurants to turn into bars at a later time or any time during the day? I think the Chicken Box has adapted and other people could comply with that as well. Melissa mentioned creating safe spaces and for our community, and it just made me think, how could we help restaurants and, all businesses, but specifically restaurants, stay safe this summer? And if there's any way that the town could help with testing restaurant employees. I know that we authorized funds to help, with first responders, and I'm not sure if any of those funds could be helped testing our restaurant employees, but if we could contain a spread there, then that could help. If restaurant employees if they're sharing employees this summer, or they're the most contact with a lot of our visitors, it could just be a way to keep our community safe. And then I just had the unintended consequences that Matt brought up about would people be kind of congregating to Cumbies or Stop and Shop, but if everything's closing at 12, then I think that would be an avoided unintended consequence. So those are my thoughts. I'm not against the early closure. I just would like to see it start off a little bit slower with the increased enforcement. Thanks.
Jim?
I would just like Roberto to repeat, who would be exempt from this? Would would people down on the strip still be allowed to stay open?
The strip is all food service, so no, they would close.
All right, so who would be exempt? Basically, Stop and Shop
and Cumbies.
And Cumbies, that's it. Everybody else is going to be shut down by 11 or 11:30, whatever we decide.
Correct.
Okay, thank you.
Jason?
Thank you, Mr. Chair. A couple things. Are we looking for a recommendation? Is there a recommendation coming from town staff, a specific one, or is this the conversation that we're all discussing, trying to pinpoint? I didn't see one in the packet.
It was initially made for the discussion. My personal recommendation was 11. I think the general consensus that we're hearing is maybe last call at 11:30 and closing at midnight. We left it open because they were 50% recommendation.
Jason?
Thank you. Everybody's kind of said some version of my thoughts, but I think if more and more people are going at 11:30, then I think, and they're feeling the pressure, I think just close on their own. And I think if everybody's doing it, it's easier for you to close. I haven't heard anything tonight or today in the last couple of weeks that this risky behavior is linked to any cases. I know it's very obviously that it could be. So I don't see any data or any metrics that any of this nighttime, at least downtown, is connected to anything that I know of. I'm not saying I would be okay with midnight, but just some questions just to do my due diligence. And then I do have a concern that's going to push people out in different ways where we cannot inspect. I don't really know what the night shift inspector can do outside of downtown. I think it's a great idea, Roberto, and staff who's come up with that. That's awesome. Those are just some of my quick thoughts.
So I try not to give information that might be identifiable to somebody. So I'm trying to find my words here. But there has been some cases that I can identify to the risky behaviors downtown. I just can't really give you more than that. I'm sorry. I want to give you more, and but there are less than to try to stay as HIPAA compliant. Less than 5 have been attributed to this risky behavior.
Roberto, I think that's all you have to say. If you are seeing it, that's what I didn't really know. So thank you.
Yeah, but
Malcolm?
yeah, that was kind of back where I was going when I spoke before. I wanted to make sure we're actually something was going to happen. That we're actually going to, because there's a lot of things we do and we feel good we're doing something, but nothing really happens. But if you're saying less than 5 out of 40 cases, that's a significant number.
It is less than 5 out of 40 cases, but let's throwing numbers out there. If it is 5, that's more than 10% of our 40 cases.
Yeah, I know.
And considering 26 of them were in the last month, less than 5 is more than 10%.
Well, you and I, we always talk numbers, statistics all the time. So
yeah,
thank you. That you push me to support it. with
Jason, and then Matt.
With that rigorous statistical analysis.
Jason?
Thank you, Mr. Chair. That is a good analysis. I think we have to think, are those numbers going to change if we push them to a house party? If people want to go out, they're going to go out, they're going to party, they're going to go to the beach. Is it going to change anything? Right? That's kind of where I'm like, the rest, I think we've all kind of said in different ways, having people in a restaurant with enforcement and the encouragement and the education is, we can control it. We can't control it at houses and beaches. I don't know if those numbers will go down if they transfer their libations and hanging out and partying somewhere else. So I'm kind of back to what you said, Malcolm, earlier, is this really going to make a difference?
So actually, in regards to the house parties and things like that and parties out at the beach, one of the things that we have been seeing behaviorally in some of the other towns and in some of the literature is, in general, you tend to party with people people with like-minded individuals, people who run within your same social circle. So you run less of an exposure to people who let's say you throw a house party at your house, Jason. You're going to invite 20 of your closest friends and their spouses. And that's it. You're going to infect those of you, if let's say one of you have it, you're going to infect those of you who are in that social circle. If the people are coming in from, let's just have some fun and say Connecticut. If people are coming in from Connecticut, we'll say, throw a town out there, Darien, Connecticut, you're going to have a group of 15 people that they came from Darien together, partied in the house together, infected each other, and then they left before they became infectious, but showed up showing cases together. And they never infected anyone here on Nantucket because that social circles never intermingle. They do intermingle in restaurants. What we do here is a party of six sits down, a party of six sits down. They're having dinner, they're having drinks, they're having things, and you hear somebody says, "Oh, I saw the Jaws movie at the drive-in. I saw Jaws at the drive-in." The person at the next table says, "I saw it at the drive-in too," and you start getting that intermingling of social circles that don't. So then you start seeing them maybe try to push tables together. They start discussing, they get into close contact. They leave the restaurant and start engaging in risky behaviors together because now they're congregating, continuing that conversation. So if it does push things towards house parties, yes, house parties can get out of control, like we saw in New Jersey, that Airbnb that had 700 people at a party, and that was because it was open to a lot of people. One of the things that we saw with the selectmen discussion that Matt mentioned earlier, one of the things that my takeaway from what I saw in the write-up of that was that it was, once again, it was a party that was in one social circle, and they infected each other, and they never infected anyone here on Nantucket. We have no cases on Nantucket that was attributed to that party and to that group of people. So it's just behaviorally, it's definitely different.
Melissa?
Thank you, Steve. I think that, again, just to go back to, some of what we're seeing is not necessarily inappropriate behavior, or anecdotally, I think we're hearing stories of inappropriate behavior at restaurants, but it's what happens when people leave the restaurants that I think is where I'm getting the most feedback from folks. Town looks like a circus. People aren't wearing masks when they leave the restaurants. They've been drinking, they're, been having fun, and they're going to the next restaurant that may be open, quote unquote, for dessert to go and continue to have fun. And, I understand that impetus and that want to be social and have fun. But I think what's happening is the behavior gets riskier the later at night it is. And then the more possibility there is to, I don't know. I don't want to sound like I'm an expert on how COVID is spread. I'm just saying that it seems to be a concern about how people are congregating in town without masks at night. And we have this mask order during the day. I think we're seeing a good amount of compliance, but it's at night after restaurants close. People have been enjoying themselves, and rightly so, but they're leaving that, and then I think possibly putting other people at risk if we're pushing them to a house party, or maybe they're just going home with a group of 12. Then I think your point, Roberto, is that it is more contained there, and it is less of a responsibility. I mean, there's no possible way for us to enforce what happens safely between leaving a restaurant and to your final destination. So, I think it's that in-between time. Amy, Roberto, the fire inspectors, everyone's doing a really good job, it sounds like, of attempting enforcement at the establishments themselves. But it's what's happening in that in-between time that seems to be very, very concerning. And who knows, maybe more people will enjoy themselves and go home earlier and, not seek a quote unquote party atmosphere. And this is a very different summer for everybody. And personally, I'm okay supporting a safer atmosphere in town late at night.
Jimmy?
Basically, when I get out, I'm a little confused. I think by shutting everything down at 11 or 11:30, like Melissa said, I mean, if we've got a hold on the restaurants and we're doing good with the restaurants and everything, all we're really doing by 11:30, if we shut them down, is putting them on the street an hour or an hour and a half earlier than they would be anyway. And like Melissa said, once they're on the street, we can't control what they do. We can't control them if they're all going to go to a party, a house party, something like that. I don't know. I don't feel good about just pushing them out on the street an hour and a half earlier. That's all.
I completely understand that concern. I think another concern is that we're putting a lot of undue burden on restaurants, and we're saying that they can control it, but then they're taking on the risk of keeping our entire community safe instead of we could make action today that could help keep the community safe. I just think a lot of restaurants are feeling this burden that they're trying to implement the guidelines and, making sure they're following everything and trying to control the people when they're, quote, uncontrollable or risky behavior. I think that's something that if we closed early, we're helping kind of relieve some of that burden. And it's going to be on our enforcers and police to kind of handle the downtown chaos, which may not be as bad at 11:30 versus 2 a.m. Those are my thoughts.
Yeah, couple points. The longer you go, the longer you go, the more people make bad decisions. They've had one more beer, two more beers. There's that whole issue. Number two is we have 5. We were talking earlier about statistics, and we have 5 cases. A lot of the young people, even the ones in Connecticut, were asymptomatic. They only got it because they only found out because they were tested. So we don't catch every single case. There are some that don't present, that don't go to the hospital. We don't know what that percentage is, and maybe Roberto does, but I think it's probably impossible to know it exactly. So I think, if we have 5 cases, is that 10, 15, 50? I don't think we know. And so I think that's, I think I support this. I would like it to be midnight. The restaurants, last call at 11:30. Cumbies closes at midnight anyway. Make it midnight for everybody else if that's what we're going to do. We're going to hear some pushback from the businesses on the strip because these guys do a lot of business with all the drunk people. From some of them do half their business after the bars close. Now maybe they're not as busy this year. I'm not sure. The bars aren't running, but we're going to hear some pushback from them. But I think that's it's a hard decision, but I think it's a good recommendation.
John?
So, I've been listening to this conversation. I think everybody are making good points. But I would encourage the boards to look at this not just from the perspective of the people in the bar at midnight who have perhaps had one too many, they're not social distancing, they're not wearing masks. But what about the person, suppose I get out of bed, I go to bed at 9, but suppose I get up and I want to have a nightcap, right? And I go into one of these establishments. Am I going to be at risk due to the risky behavior by other people? And is that a legitimate public health concern that the board may want to think about?
Melissa?
Steve, thank you, Steve. I also just wonder, I know we asked it a little bit ago, but if there are any participants on who wanted to make any public comment, I'd be curious to see if anyone has any feedback they want to share with both boards. But that's certainly up to you and Don.
Jim?
The only thing I'm thinking about is, and I understand about risky behavior and everything, but what about all the food establishments on the island that don't serve liquor? You're affecting them in the same sentence you're talking about risky behavior from people drinking too much at a bar. there are a lot of food establishments that don't sell liquor. So what do? We're going to make them close early just because we're making the bars close early? I don't think that's very fair. I mean, like you said, the people on the strip, they don't sell liquor down there, but that's when they make all their money. When all the other places close, people go down there to buy food. But if we're saying it's the restaurants with the liquor that are causing the most problem. So then everyone's going to have to pay for that. And that's where I have a hard thing agreeing with. I really do.
So it's the worst behavior, the most risky behaviors we have been seeing have been on the strip.
And Roberta, you're talking about observations sort of after leaving a restaurant bar situation before the next destination, where people are walking freely throughout town without masks on, getting closer in line with each other, potential for belligerent, no, I'm in line. That's what you're talking about, right?
Yeah, so I'm going to see if I can get a hold of one of the pictures from Saturday and bring it up about one of the behaviors that we were seeing. It's very difficult. The most once they leave the restaurants and they're a little bit more inebriated than normal, they get in line at these restaurants, these non-liquor restaurants, where they tend to congregate in not a lot less risky. I mean, a lot more risky. So real quick, let me put this picture up in an area. I'm going to share my screen real fast. This is Saturday night at 10:30. I'm not picking on just them, but this is the crowd that you see, and more than half of them were not wearing masks. This was this past Saturday. So it's once they leave the restaurants that they've had a few drinks and they're looking for whether it is dessert or something else, or that late night drunk food or something like that. We're seeing just a lack of distancing, lack of masks, lack of safety there. And then a lot of them are also sharing drinks and sharing spoons and stuff. Malcolm.
That picture you showed is not just at night. I live about a block and a half from the strip, and it's like that all day, quite frankly. So it's not just at night. Well, I'll attest to that. Picture happens frequently all day long and at night.
Christy?
So do you think this would be a case where enforcement would result in better behavior if we, had enforced or had written warnings or fines for the business for not maintaining social distance in their waiting lines? Then that would kind of prevent, again, the whole food service industry to be shut down, but could better enforce these few that we're seeing the large crowds at.
We can enforce. We can give tickets to this particular establishment. We can give tickets to the establishments just up the strip from them. It's exactly the same conversation we were having last week.
Jason?
I think from a business owner perspective, you would weigh down, okay, if we know with contact by the town to say like this has to stop, or we're going to close. I would look at it and say, okay, how many staff do I have to put out there to monitor, or what kind of system do I need, or look at that and weigh it and say, okay, staying open till 1 is still, or 1:30, whatever the food has to stay till, is worth it for me to manage it out there. I don't know what that cost analysis would be, or even if it's even possible. I'm not even sure exactly what I'm saying. I'm trying to think of if you said to me, the handlebar, like, Jason, you gotta do something about your lines, I would think about, okay, what's my cost of making sure I can comply and be safe versus having to, shut my coffee shop down at 3 versus 4, something like that. Not really enforcement, but communication of like, this is coming down the road. If you can't, take care of it. I don't know.
Greg?
Thank you, through you, Mr. Chair. So in listening to this conversation, I can see the distinction that you're struggling with. And this does not necessarily have to be a one-step all or nothing proposition. So in my opinion, you could proceed with issuing the order requiring the sit-down restaurants to have last call at 11:30 and close by midnight, and allow the takeout restaurants that don't serve alcohol to remain open until regular time, with a warning that we're going to take this up again next week. And if things haven't improved, then we have to go to the next step, which is to shut everybody down. I do believe that there is a rational basis for distinguishing between the sit-down restaurants that are actually serving the alcohol versus these other restaurants that are not. But at the end of the day, the overall goal here isn't really to regulate the conduct that's happening inside the restaurants, although that may be part of it. But it sounds like the bigger problem is what's happening outside the restaurants after the people leave. And so I think you can reasonably say, okay, if we stop people from drinking for an hour and a half, that's, that much better that they're going to behave, that much easier for the takeout restaurants to enforce social distancing, but with a warning that the onus is on them to actually do that. And if they don't, then you will take the next step, which is to shut everyone down early.
Matt?
And I think what these restaurants that are struggling are asking for is a presence. If there were if there were a town official, if there were a policeman, I know the police aren't doing it, but if there were someone there, if Amy Baxter, I know she needs to sleep too, but if someone were there, the lines there would be a lot more compliance. But the fact that there's nobody there, and the businesses have tried, I've talked to some of the people down there, they've tried, they go out, people all spread out, they go back in and they keep working, and it all happens again. People have to, what's the big deal? So that's where they are asking for help. And I think that, my push and plan was to say, how do we, it should be a conversation with what direction can the line go that people will be 6 feet up? How do we set up? It will be safe and will work. And they aren't congregating out into the street, anyway.
Malcolm?
I think enforcement of that area of town is very important, and it's not being done for anything. If you go down to that corner, down that street, it's not just the food businesses, it's the other businesses on that street that have people congregating in front of them. You can't drive down that street. You have to go. I'm afraid when I go, I'm going to run someone over. That whole part of the island right now is enforced by no one, and it is no social distancing hardly at all. It's a dangerous place. It's a dangerous place to get the virus, and it's a dangerous place to ride a bicycle or a car. There is no enforcement by any public officer there at all.
Anybody else want to comment? Christy?
I'd be in favor of Greg's suggestion of starting out with limiting the establishments that serve alcohol and seated establishments, and kind of taking that with the increased enforcement and the enforcement plan that Amy presented, and then kind of moving forward week by week and monitoring it. Personally, I reached out and talked to a lot of the restaurants and heard from a lot of those establishments, and did not do a lot of the takeout establishments because I wasn't thinking that they would be affected by this. So I would like time to, talk to the constituents and have feedback from them before kind of putting a total kind of moratorium and early closure on everybody. Thank you.
Dawn?
I agree with Christy, but I also wanted to let you know that someone has their hand raised, one of the attendees.
Hi, am I supposed to state my name?
Yeah, go ahead.
Yeah, my name is Roddy McKelvey. I was just curious, do you guys feel as though, and how do you feel that you can do this in setting the tone on the island to get people to be social distancing, as you all have talked all afternoon long about how it's their personal responsibility. So I'll just pose that question, and do you believe it's your, or how do you think you can set the tone on the island?
Anybody want to grab that?
Melissa?
I'm not entirely sure I can respond to Roddy. Other than that, I think the town has done a fairly respectable job in terms of communicating and continually reinforcing its communication at points of entry, with our COVID educators, with signs, email communications, Twitter communications. Frankly, I'm not entirely sure how much more we can do other than continuing to beat that drum consistently, and maybe in some ways a little bit more loudly. And I think our partners in the Chamber of Commerce, Real Estate Association, Lodging Association, all of those associations have some responsibility to help the town with that messaging. But I don't want to go back to Christy's idea. I also support that, your recommendation, Christy, but I would like to see, based on your observations, Roberto and Amy, written warnings to those establishments in those locations that are not practicing social distancing with their clientele, and also that sort of warning that these boards can take this up next week or anytime sooner if we feel that and they're on notice, they're on watch, and I feel comfortable that they're going to either do the best they can to get the staffing they need to make sure those lines and establishments are, following appropriate social distancing, or they may choose to close earlier themselves, and that will have to be a business decision. But I like that idea of separating out the establishments with sit-down service versus takeout, but notice and warning notices being sent out to the establishments that seem to be not helping manage the social distancing on the lines that come out into public spaces.
Greg?
Mr. Chair, not to try to cut off discussion in any way, but I just want you to be aware that I have a proposed motion to that effect, if you'd like, when you're ready.
Okay.
There's another comment. Deborah King.
Deborah, go ahead.
Oh, can you hear me now?
Yeah, yes, go ahead.
I mean, we've identified that these are large areas where people are congregating both during the day and at nighttime, and we don't have enforcement there. So I'm not sure what the extra week is going to do. I mean, we have an identified problem. Roberto is saying that that's where the issues are happening, at least 5 cases. I don't know why we're waiting another week. They're not even correcting themselves during the day. I mean, so I would think that would be where we start, is during the day, and let's cut off the nighttime and a uniform time at the same time that you're cutting off the other food establishments. And if they get their act together during the day, well, we consider opening them up at nighttime. But we know that that's a problem, and we're going to have more people coming here, not less people coming here. So it seems like we're sticking our head in the sand a bit here, as far as I'm concerned.
Deborah. Matt?
Yeah, quick question. Can those businesses legally tell people what to do on a public sidewalk? Just a legal question. Are we asking them to do something, and are they allowed to do it? Can they walk out in the public and tell everybody who's waiting to get to their entrance, to their order station, please, I'm making you get 6 feet apart? Or does that have to come from the public, from us?
Greg or John want to take that? Greg?
Thank you, through Mr. Chair. Yes, it's my opinion that the establishments have the authority and the responsibility to issue that order. While people do have a right to be on a public sidewalk, it's for the purpose of travel or other purposes necessary for use of the sidewalk. If people are congregating on a sidewalk in order to provide business to a specific entity, and those people are creating a hazard or a nuisance, it's the responsibility, in my opinion, of the entity to make sure that those crowds are properly behaving themselves by social distancing and wearing masks, and that it should be the responsibility of the business owners to undertake that enforcement in conjunction with enforcement by town officials, to the extent that they have the, that they witness that type of behavior.
Amy?
I just wanted to follow up and say that as far as that picture, there was a written, I don't know, I want to call it a warning, but to the specific business regarding better management of their customers and their line, especially since we do have more lines on sidewalks because everyone needs to do social distancing. The next door retail shop needs to do social distancing. The restaurant on the other side of the corner has folks outside because it's not safe to be inside. So it's been a problem long before this pandemic, but there was a written exchange in which we were not going to add any more barriers or create more space until they actively managed that line, just like we would ask any other establishment to do so outside of their business. So that communication is out there and has been touched upon already.
Okay, we seem to, I'm going to tell you how I feel. I'd be at for the early closure with putting on my public health hat. I believe that it's going to help. And, any way we can help is fine with me. And I'd be glad to hear that motion that Greg was going to propose.
Thank you, through you, Mr. Chair. So I can offer the motion with the non-alcohol establishments being allowed to stay open, or I can offer it as it applies to everyone. Which would you prefer?
Board of Health members? Jimmy, go ahead first.
I would like to leave the non-alcoholic business open with a stipulation that they have 1 week and 1 week only to solve their problem with the lines outside, or they will automatically be closed down.
Okay, so through you, Mr. Chair, I would suggest the following for purposes of discussion. I move that the board order that all restaurants that offer alcoholic beverages for on-premise consumption have last call for service of alcohol by 11:30 p.m. every night of the week, and that such establishments shall close and remove all customers by 12 o'clock midnight every night of the week. It is further ordered that all such restaurants shall not serve alcoholic beverages to any person who does not also order food. This order shall not apply to restaurants that do not sell alcohol for on-premise consumption or takeout only, provided that staff is directed to strictly enforce social distancing and mask requirements to the extent possible, and that all such establishments are warned that they are required to enforce these guidelines as to all customers, and the board will revisit this issue at its next meeting in 1 week.
Christy?
Can I ask a question? How would this apply with the cocktails to go that just passed through the state? Would all the establishments only be able to serve even to go food till 11:30 as well?
So that legislation allows for cocktails and the others as well, beer and wine, with to-go food purchases only, and the limit, they can't do it after midnight or earlier, depending on what is the license or what is the license time. So midnight already is the limit for that.
Thank you.
So to Greg's motion, can I get a second?
I just, well, Mr. Chair, it's not my motion.
Oh, yeah.
It's a suggestion for someone else.
I will make that motion.
I'll make a second for purposes of discussion. Which I'm hoping Malcolm will say something because he looks like he wants to.
No, I'm uncomfortable.
Mary has her hand raised.
If you look at the, say, location down by the strip, I don't think there's, with all the businesses there, particularly during the day, that there's a physical possibility of really limiting people on that street, that area. So are we going to put it off for a week and then ultimately have to go back to the 10:30 for all businesses? I mean, I wish someone would help me here because I'm struggling.
Matt?
The only thing I could think of is the side is funneling those lines down the side street, you know, in between the juice bar and the other businesses. If the lines funnel down that side street toward the Dreamland, that's the only way I could see it working. It doesn't work going back to the Rosencrown because the Rosencrown is taken over the sidewalk. So, you know, there has to be a way to funnel those lines.
And during the day, you can't do it because the bike shops, there's 200 people in front of the bike shops.
Steve, Mary has had her hand raised electronically for some.
Yeah, I don't know how you see that, so.
I have it on gallery now.
All right. I will think about this. Just go on.
Should we take the comment from her?
Yeah, she's been on the computer the whole time.
I'm just saying I can't vote.
Oh, man.
I excuse myself because I have a family member at a restaurant. So
Okay. Dawn?
I think that they probably are going to need to consider down in the strip location or similar locations is a virtual queuing system. I mean, it's something that that is a potential, so that people, you know, essentially get an appointment to go get their ice cream. And we just may be at that where they're going to have to try and get creative like that. Something to think about.
Matt?
I mean, having just done something similar, it is weeks of work to get it to work. At least it was for us. You have to have the right system. You have to be able to contact people with the phone, on the phone. It's not easy.
Christy, then Jason.
Amy, I know you've done a lot of research about taking away different parking spots. Would there be any appetite to remove parking spots on Broad Street to help with the line management?
Well, am I on here? We actually, so for one location, because they had abutters that the line was becoming a problem, there were sawhorses put out to help and take out a parking space for that because they had such immediate abutters. And then I saw that a problem this weekend because people went all the way out into the street. So we have to adjust those sawhorses. But so we did that. The other location, we did ask them to go down that alley. We did ask them to be creative and maybe try to find some app solutions or to manage that line. And I, you know, other than putting some tape on the sidewalk, I haven't seen that actually happen. We you know, they asked to take out more parking spots along that alley. You know, I think our preference was to actually make an attempt to come up with some sort of solution on the business's part first, rather than just going into providing even more property for that line. It's already taken up 2 whole sidewalks. So I think certainly we can look at that. But we already have tried to make at least some adjustments there too as well.
Melissa?
So, you know, I'm hearing that there's some concerns with the motion that's on the table, but maybe we should vote on it. And if we're not comfortable with this motion, if it does not pass, we can come up with a motion that does satisfy the board. I'm just offering that up.
Well,
No. Good.
Mr. Chair.
Yeah.
I don't think there's an easy solution for that particular part of town for all the reasons we've talked about. I will vote for this resolution, but I think in a week we're going to be back to having a 10:30 closure. I think that's probably the only solution.
For what it's worth, Malcolm, I tend to agree with you, but I feel like it's worth the week to see if creative minds with some pressure from both boards can make an impact. And it's worth that shot to me, with the long-term scope of really trying to help our seasonal businesses capture revenue that they rely on to feed their families and their employees' families. You know, I just, before we make a heavy-handed decision, I think a nice, strong warning and see if there's any adjustment that they can make is great. But I'm hopeful that we'll be back here in a week, either with solutions or going to the earlier closure.
Well, now it seems to me like it sounds like everybody would just want to wait a week to see what happens. And then if we have to put some type of early closure and meet again next week, then that's what we would do.
Just to be clear, Steve, my suggestion was as it pertained to the takeout on the strip. I support the motion as it was read by Greg in terms of the restaurant closures, particularly those with sit-down service, and with that warning of review. Let's see what happens with the takeout. I guess we'll just call the strip out this for the strip next week.
So by one of our own board members, then can I get a motion to what was said by Greg?
I thought I made that motion. I'll make it.
Okay, can I get a second?
It's already been made and seconded.
Okay, then all in favor by roll call vote as I see you. Jim Cooper,
Yes.
Melissa Murphy,
Yes.
Meredith Leffery still on. Meredith,
I have to recuse myself. I have a family restaurants.
Malcolm McNabb,
Reluctantly, yes.
and Chairman Steve Visco says yes. So the motion passes. Jason?
Thank you, Mr. Chair. I had my hand up earlier, but I'm not on Board of Health, it was my motion, so I just kind of tried to back off. Can we get clarification of what's going to happen on the strip? Again, I just worried that if this goes too far during the day, they will all have to close because they're not going to be able to manage a line. And I didn't hear Roberto or anybody say that cases are coming during the day. It was late night with risky behavior. So I think if we work with them on trying to, whatever somebody suggested, queuing apps and whatnot, but I heard it was night risky behavior, and that's what we're addressing. I thought maybe it was a part for the daytime. I don't know risky behavior during the daytime that was connected to cases.
No, I don't think that the daytime thing was in there, but Greg, could you just maybe read that back to Jason?
Yes, through you, Mr. Chair. It does not address daytime. The motion, and I've sent a typed version of this to the chair and to Erica and Roberto, but I'll read it again for everyone's benefit. I move that the board order that all restaurants that offer alcoholic beverages for on-premises consumption shall have last call by 11:30 p.m. and shall close and remove all customers by 12 midnight. It is further ordered that all such restaurants shall not serve alcoholic beverages to any person who does not also order food. This order shall not apply to restaurants that do not sell alcohol for on-premises consumption or takeout only, provided that town staff is directed to strictly enforce social distance and mask requirements, and the restaurants are required to require their customers to comply with such requirements, and the board will revisit this issue at its next meeting in 1 week.
Okay, Chrissy?
Sorry, just one more clarification question. With the serving food, with the consumption of alcohol, how does the Chicken Box or Cisco Brewers, how are their permits?
Those are because of current conditions, they have the same type of license. Food service is required right now for them to be open. Chicken Box cannot be open for alcohol only. So it's the same, it would be the same requirements.
Thank you.
I think Cisco Brewers closes at 7 anyways. Anybody else have any questions or comments? Melissa?
Sorry, Steve, I just want to say for the sake of it that, there's a lot of public concern around the spread of COVID-19 and our community's ability. I think, Matt, you referenced this earlier, our community's ability to safely open for school in September and operate safely in the fall once this massive influx dies down a little bit. And I don't think either of these boards, I certainly don't, make these decisions lightly if there weren't a demonstrable public health risk that has us making these orders. And so I think it's just really important that I think this is a good compromise to work with our business community, but also try to keep public health and safety at the forefront. And I thank everyone. It's a 2-hour meeting or more today. This was good conversation, and I look forward to next week. I hope sincerely that we see some, great compliance and great action by businesses who, rightly so, have a lot of people who want to go in, get their ice cream, get their chicken sandwiches. And I hope we can see them be as creative as some of the other business community members have been to control those lines.
If you're pointing to me,
Yeah, go ahead. Yeah.
Is this effective immediately? Does this start tomorrow night? People a couple days?
I would believe that would be effective unless we wanted to set it. Amy?
Yeah, I would request setting a time. I tend to not want to put something out at 4:30 on a day. So if it starts tomorrow, what is tomorrow? Friday? Yeah, I can't imagine someone has a 11:30 dinner reservation. So as long as we just say effective immediately on Friday, July 31st, I think that'd be helpful.
I'll make that motion. Effective on July 31st at midnight.
I'll second that.
All in favor by roll call, as I see you, Jim Cooper. I'll come back to you. You're still muted.
Yes.
Melissa Murphy,
Aye.
Malcolm McNabb,
Yes.
Meredith.
I don't know if I can vote on it, but
Then Chairman Steve Visco says yes. So the date effective July 31st, midnight. Anybody else have any other concerns? Okay. Everybody's good. Seeing none, can I get a motion? Wait a minute. Melissa, go ahead. I see you.
Sorry, Steve. I did just want to talk about, I have received some concerns about large groups at some of our public beaches without masks during the day, party atmosphere. I think there was that photo, I don't know when that was taken, I think over 4th of July weekend at Nobodier. I think that we had some response that there are patrol officers trying to help. I just think it would be nice if we could address that publicly so that anyone who has concerns about the beaches can feel a bit assured that we're on it.
Libby has her hand up.
Yeah, go ahead.
Just want to say, we're doing the best we can with the beaches. They are a real challenge, and we've been saying from the very beginning, again, personal responsibility is a major issue at the beach. We do not anywhere close to have enough police officers or any other people to patrol every single beach all day, every day into the evening to disperse crowds. So we do have, thank you, Melissa, for mentioning it. We do have evening patrols that are out up till, I think it's around 10-ish, Stan. Maybe Amy would know, or okay, Jason's raising his hand. Oh, he's leaving. And we are doing our best to address the carrying capacity of vehicles at all of these beaches. But it's really challenging, and we're trying to get our messaging out as best we can. We have public social media posts pretty frequently about this, as well as radio spots. And, you know, this is a challenge for all places that have public beach situations. And I'm sure we don't want to talk about closing them.
Thanks. Yeah, it's a tough job for all those guys to try to manage it. Any other concerns? Okay. Okay, Christy.
Just a question. With next week's meeting, do you want that to be a joint with select board or just a Board of Health meeting?
It doesn't matter to me. How's the rest of the board feel?
I don't have a problem with select board.
Yeah, we could. Roberto, you good with that?
Sorry, what day were you hoping to have a meeting on? Because it's not on the schedule.
What day? Thursday, Friday?
Thursday does not work unless you want it in the morning. Friday is available anytime.
Yeah, I'm available at any time Friday if that works for everybody else.
Friday works for me.
Yeah, the 2 o'clock time frame is great. I don't know, and in terms of it being a joint meeting, I think it's actually really nice to have both boards in sync and being able to respond to community concerns. So I appreciate it.
So 2 o'clock Friday the 6th of August? Is that what I'm hearing? And it's a joint meeting?
Yeah, to another joint. Yeah.
I'll get NCTD to schedule that.
Thank you.
Thank you.
Anything else? Okay, can I get a motion to adjourn the meeting?
So moved.
Okay, a second.
Second.
All in favor by roll call, Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Chair says aye. Okay, thanks to everybody for showing up.
I'll need to adjourn the select board meeting too.
Okay, good.
So moved.
Motion to adjourn
Second.
by roll call, Melissa Murphy,
Aye.
Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Don Holgate, aye. Jason Bridges had to drop off. Thank you all.
They may be allowed in a future step within phase 3 or reopen with phase 4.